Today's lecture is on the inguinal canal. Now, the inguinal canal is a short passageway which extends laterally to medially and allows for the passage of external sexual organs in men. Now, this pathway is fairly complex, so to understand it, we need to talk a bit about the development of the inguinal canal. So, in development, there's this structure called the gubernaculum, which attaches to the future testicles and actually yanks and pulls down on it, effectively creating the future scrotum here with this outpouching. Now, as well as all three of the levels of the abdominal muscles are being yanked along with this outpouching, as well as the peritoneum is included in this. And this outpouching of the peritoneum is called the processus vaginalis. Now, if the processus vaginalis, which normally deteriorates, if it continues on after developmental period, this could be a reason for inguinal hernias, and we'll get to that in a little bit. So essentially, the gubernaculum pulling down and creating the scrotum is what drives the testes forward, and why our testicles are essentially descended from the abdominal muscles. So, looking at this diagram, we see that we have a lot of different layers here, but to help you understand these layers, we have to understand that there are boundaries to the inguinal canal. So it has an anterior, posterior, as well as a superior and inferior boundary, a roof and a floor, if you will. So the anterior boundary here is made up of the aponeurosis of the external oblique muscle, seen here in green, as well as the internal oblique muscles a little more laterally. So it's these two muscles, starting off with the aponeurosis of external oblique muscle, and then moving laterally over to the internal obliques. Now we have a posterior boundary, which is made up of this red layer here called the transversalis fascia. Okay? So our roof or superficial boundary is made up of the internal oblique muscle, the transversus abdominis muscle, as well as a portion of the transversalis fascia. Now what happens is these muscles continue on and split where the spermatic cord comes through, and it forms a roof over the canal, and then these fibers actually join together, and it's called the conjoint tendon, or essentially the roof of the inguinal canal. And we also have the floor of the canal, which is actually the top portion of the inguinal ligament, as we can see here in blue. So essentially creating a passageway for the spermatic cord. Now I've not included all of the layers in my diagram, but I have a mnemonic here for you to help you understand all of the different structures that are passing through within the spermatic cord. And I have the mnemonic here from our friend Gabe: pills don't contribute to a good sex life. Now these stands for pills, pampiniform plexus, don't, the ductus deferens, contribute to the cremasteric artery and fascia. 2, testicular artery and the lymphatics. A, autonomic fibers, good genitofemoral nerve, sex sympathetic nerve fibers, as well as lymphatics for life. So clinical relevance, we can have two different types of hernias that are affecting this particular canal. So we can have an indirect or a direct hernia. Now an indirect hernia can occur through the processus vaginalis remaining patent or not deteriorating, and essentially allows for an easier passageway to come through the internal inguinal ring and allow abdominal contents to herniate into the scrotum after the inguinal ligament. So an indirect hernia would happen through the internal inguinal ring, continue on out, and then out the superficial inguinal ring. And a direct hernia would be normally from a weakening in the abdominal walls here. So the hernia, or the abdominal contents, would directly herniate through the muscles and then out through the superficial inguinal ring, completely not even bothering with the internal inguinal ring. Now, the reason for pointing out the inferior epigastric artery and vein is that the clinical relevance of this landmark is to allow a surgeon to determine whether or not it was an indirect inguinal hernia, which would occur lateral to the inferior epigastric artery, or if it was a direct hernia, which would occur through the abdominal muscle wall and would happen medially to the inferior epigastric artery, and would also be slightly lateral to the rectus abdominis muscles and the pyramidalis muscle. And that's the inguinal canal.